Hello everyone, I'm Dr. Trishla Yadav, a senior physiotherapist from CoreWorks Pune. I hope you all are doing okay, and today I'm going to be speaking about a simple clinical tool, the 6-minute walk test. This tool helps in understanding the functional status of our heart as well as the lung. With the rise in COVID infections and the impact that it can have over our lungs, it is important to know about the oxygen status in the body for a COVID patient. Oxygen levels which fall below the state of 94% are considered to be requiring medical attention. And hence, for patients who are being treated at home, it is extremely important to measure their oxygen levels. Hypoxia refers to the condition where the oxygen availability in the body is quite less. Moving on, there are two types of hypoxia that we need to be aware about. The first type, in which the patient is at rest and shows less oxygen available in the body on the pulse oximeter readings. And the second, which is called the silent hypoxia or the inducible hypoxia. For the inducible hypoxia, the person needs to be exposed to a particular activity in order to understand if his oxygen levels are dropping or no. Moving on, it is important to know that oxygen levels do keep fluctuating when we are doing a particular activity, for example, walking, climbing stairs. So, if it is within the range or if it is above 94% and fluctuating, we would still consider it to be okay. But if it is falling below the level of 94%, then it is important to consult your physician for the same. The 6-minute walk test is a tool which helps in identifying if our patient is suffering from inducible hypoxia when he is exposed to something as simple as walking. Moving on to who can perform this test and who cannot. Individuals who are going to be suffering from COVID or who are healthy can perform this test provided that their oxygen levels are above 94% and not fluctuating to the lower threshold. In addition to this, an individual who's above the age of 60 can also perform the test, but the duration of the test can be reduced to 3 minutes for such an individual. It is important to make sure that the patient is comfortable as well as free from any symptoms which would aggravate the condition, and hence it is always good to do the test only after taking an advice from your medical practitioner or your physiotherapist. Moving on to the people who cannot do the test, all the individuals who've had any recent abdominal surgery, heart surgery, heart attack in the past or in the recent area, or who have a history of angina, it is preferable for them to do this test only if under medical supervision. In addition to this, patients with unstable vitals, for example, whose oxygen level, heart rate, blood pressure are fluctuating constantly, it's better to do this only if given an advice by a medical practitioner. Moving on to how to do this simple test. All we need is a pulse oximeter and a hallway which is free for the person to walk. We need a point A and point P which can be set up within our house, and we can have two landmarks which are going to be placed at point A and point P. Our pulse oximeter is going to be attached to the index finger of the patient, and the oxygen levels are going to be recorded before, during and after the walk. It is important to know that the oxygen level has to be above 94%, and if it drops below, it is important to have a consultation with your medical practitioner. In addition to this, it is also important to know that if there's any symptom of lightheadedness, dizziness or uneasiness, it's always preferable to stop the test. This could also be a sign of hypoxia, and hence it is important to inform your medical practitioner about these signs if they arise during the walk. The only instruction which needs to be given to the patient is to walk at his own pace for a duration of 6 minutes. It is always preferable to keep a chair close to the patient so that in case during the walk he feels uncomfortable or if he feels like terminating the test, he can just take a seat. The next important thing is to keep a timer and ask the patient to walk for a duration of 6 minutes as much as he can at his own pace. Following this, the oxygen levels are recorded, and this can be done twice a day in order to understand the recovery of a patient in case he's had hypoxia or in order to understand if our patient is suffering from inducible hypoxia. Thank you.